Good afternoon, everyone, or whatever time it is for you that are tuning in late or early. I'm Dr. Dave Pascal, and today I'm going to talk about, we glitched. Today I'm going to be talking to you about many of the treatment modalities in my office. I've been telling people I have like 32 or 40 different treatment modalities, but I walked around my office just now and I added up most of them, and I just compiled a list of about 62. So, this is a question I get asked a lot because people usually when they contact me with CRPS, they've already been to a lot of clinics, they've had a lot of care, and they want to know what I'm doing because they don't want overlap. And what many people don't understand is even if I had the exact same therapies as someone else had the same things that I do, I still have a different approach. I have a different rhythm. It's like calling a gym and asking, well, what weight machines do you have? Because I went to this other gym and I didn't get the results that I wanted. It's not about the specific weight machine, or is it a machine weight, a free weight, how heavy or light the weight is. It's how you apply those weights, right? How often are you going? How many reps are you doing? Are you doing light days, heavy days? Are you going fast? Are you going slow? There's many factors that all go into just a simple thing like lifting weights. So just imagine how complex it is working with the human body, working with complex regional pain syndrome, which is a terrible disease that literally only a handful of doctors on the planet can successfully get people into remission. So I'm going to go through a bunch of these. I'm just going to list them out. I don't think I'll have time to do a specific how you use it or what they do, but I will leave that in the question column. You can ask longer, more involved questions either right now on this live or in the future. So forgive me for just looking, but obviously I'm a chiropractor, so we provide chiropractic care in my office. This is my 37th year treating patients, and I have more than 37 years of learning different techniques and nuances into the application of what I do. Frequency-specific microcurrent, shortwave diathermy, ion cleanse, reverse iontophoresis, red cold lasers, infrared cold lasers, violet cold lasers, pulse electromagnetic field therapy, Irconia cold laser, quantum neurology GRT light, both LED and infrared, Avicen, which is great for pain reduction, Solara Gym with full spectrum lights, zero gravity chairs, which help push you into a parasympathetic state. We have a medical photon system from Germany, Vector, Resimax, whole body vibration, LIVO2, which is the best way to heal any type of brain injury, halo therapy. My machine is from Estonia. It's amazing for boosting your immune system. The HapB NeuroStem device, Stanford NeuroStem device, NeuroSage, Phase, which is my own technique for resetting the immune system. We have ICANN, which is inborn continuous activated neurology technique, which will pinpoint exactly what system in your body has deficits and correct them. Human touch massage chairs, recumbent bicycles, total power hydraulic weight machines, four-way neck machine, oxygen concentrator, Dynatron 2000, isometric rehab, free weights, elastic band, Swiss ball, Busan ball, core stretch device, brain tap, more than 100 different supplements that I've researched and studied for my entire career, drop table, power flexing for lumbar spine injuries, CryoFos, Sound of Soul from Austria, based on the work of Dr. Emoto in Japan, ARP wave machine, piezo wave machine, vestibular chair therapy, Rothschild infrared, olfactory therapy device, gustation therapy, quantum gate therapy, sensory integration therapy, myotome reset therapy, brain calm. What else do we have here? Theragun, rapid release fibrocussor arthrostim activator, Roy G. Biv, glasses therapy, octave tuning forks, fractal therapy, Sheen sensory vials, myofascial therapy, Swiss Bionics slow level PMF, Swiss Bionics brain entertainment device, and Flowpresso, which is a lymphatic drainage. So that is just a mouthful. And of course, just like if you're cooking and you have 100 spices, it's not just the spices, it's how you put in the spices, the amount, the order. And when a patient comes into me, yes, I have these available, and maybe the guy down the street could have some of those, or the woman down the street, but it's how you apply those, in what order, how much, how long, what the intensity is. So it's not merely having a laser or having microcurrent or having a lymphatic drainage device. It's when you use it, how you use it, where in the course of the day, over the course of the therapies. So I hope that is enlightening to all of you. And I don't know if we have any questions. Danielle?
One of them is, what are the benefits of whole body vibration therapy?
Great question. So I love whole body vibration. Not everyone can do it. Most people with CRPS cannot tolerate vibration. It's a major trigger. But for those that can, vibration is incredible. You stand on a platform and it vibrates. The platform vibrates. It shakes all the cells in your body. The body's cellular response to that shaking is it's a physical threat. So it actually boosts the immune system. It stimulates detoxification. It stimulates the release of hormones. It boosts your immune system, increase mental acuity. If you do physical exercise while you're doing vibrating, you get up to 30% more strength benefits, which is amazing. It was the only thing that NASA found would help the astronauts when they were in space with bone density. All of us, as we get older, more so with women, bone density is a major factor. Older women in their 80s or 90s, their major cause of death is pneumonia. How do they get that pneumonia? They fall and break their hip. Why did they break their hip? And then they go to the hospital to fix the broken hip, and then they get pneumonia in the hospital, and then they die from the pneumonia. Why did they break their hip? Because they're osteoporotic. If you're a woman out there, no matter what your age is, if you can tolerate it, I strongly suggest getting a low vibration, whole body vibration machine, and get on there up to 20 minutes 4 times a week, because it will increase your bone density. It's the only thing that NASA found would help the astronauts when they went into space with zero gravity.
Well, they kind of bounced off of it. They said I heard that it helps lymphatic system flow better.
Yeah, so then another thing that the whole body vibration does is it does help stimulate lymphatic drainage, increase blood flow. It's great therapy.
Okay, the next one is, can anybody get LIVO2 for themselves directly?
Yeah, so LIVO2 is amazing. I love this device. It is specific for brains, and all the research on brain injury, whether it's cognitive decline, traumatic brain injury, a stroke, the major way to repair brain tissue is with oxygen. And so over the years, we've tried all sorts of tricks like, hey, just be a better breather, or we'll hook you up to an oxygen machine, or we will put you in a hyperbaric chamber and make the molecules of oxygen smaller so that they can get deeper tissue saturation. But the very best way is with LIVO2. which uses a little trick, a neurologic trick, to get the oxygen deeper into the brain. A patient is breathing oxygen, they're exercising, but their oxygen levels are fine, because even though they're exercising, they're burning more oxygen. They need they have more oxygen there. But then at a certain point, we turn off the oxygen supply. The amount of oxygen in the blood starts to drop. The body panics. It triggers a neurologic reflex where the arteries expand as wide as they can to take more blood with that limited oxygen deeper into the brain. When those doors, those arteries get wide open, we turn the oxygen back on, and the special reservoir pours the oxygen deeper into the brain. So we get deeper penetration, higher saturation, and that in turn helps the brain. They have their own website. It's Live, L-I-V-E, LIVO2. I don't get a commission on that, but anyone that can tolerate it, I highly recommend everyone get their own home unit. It is truly an amazing machine, whether you have a brain injury or you want to maintain sharp mental focus.
And I think you kind of answered this question when you were talking about LIVO2, but the benefits of the hyperbaric therapy for CRPS?
Yeah, so hyperbaric chambers are great. I had one for almost a couple of years in my office. You're in a chamber, you have to be in there for about 90 minutes, needed close to 100 therapies, sessions to really benefit, which is a lot of time in those chambers. But they do help drive oxygen deeper into the body. The problem that I have with it personally is that it does take a long time. It's a 90-minute treatment time and a high number of about 100 treatments. Good. That's the end of my questions. Wow. Well, I will probably then describe some of the therapeutic benefits of these other machines. So lasers, a lot of people are using cold lasers these days. It's kind of a buzzword, red light therapy. But when I was first exposed, no pun intended, to red light therapy or cold lasers almost 25 years ago, they were not legal to use in the United States, even though they've been used for over 40 years and there's tens of thousands of double-blind research studies. The FDA still hadn't approved them. But after a couple years, I think about 2002, 2003, somewhere in there, the FDA finally approved the use of red light therapy or cold lasers in the United States. And here's why. There's a specific wavelength of light, about 635 nanometers. This wavelength, which is red, and you can see a visible red spectrum, will stimulate the mitochondria, which is the engine of the cell, to accelerate cellular repair. Since all of your cells have mitochondria, almost any problem that you have will benefit from red light therapy. I'll give you a good example of this. If someone broke their leg, they have to be in a cast for about 6 weeks. But if you expose them to red light therapy at 635 nanometers for about 20 minutes a day, every day, that person would heal in 2 to 3 weeks instead of 6 weeks. Imagine how much less atrophy there is, how much less time they're in pain. Red light therapy is a great benefit, and it doesn't matter if it's infrared LED scattered light or if it's a laser where you have coherent, all the light is in a beam. The only thing that matters is the frequency of the light, which is 635. And there are some subtle nuances of how fast or slow you flash that light, but that's the gist of it. Another therapy that we use a lot of is pulsed electromagnetic field therapy, PEMF. There are these machines, they have these coils, and the coils generate a magnetic field. And that wavelength is actually the same magnetic field that the Earth generates. And what the research scientists have found is a very specific wavelength that helps, I think it's 7.2 nanometers, that helps stimulate and accelerate cellular repair. Now, there is a caveat warning with PMF. Some PMF is so weak, it's like grounding, like laying at the beach or going and laying on a grass field. That is therapeutic. It's just very slow. And then you can definitely, in my opinion, have too strong of a PMF treatment. The very first PMF unit that I was exposed to was a machine with these giant cables, coils, you could see them, and they put them over my knee, and they did a 1 minute treatment, and I literally was nauseous for the next 3 days. I could not get out of bed. I have talked to a lot of docs, a lot of patients, and they all have had similar experiences, or many have had similar experiences where the PMF unit itself is too strong. So it's kind of like heat. If you're near a campfire, you can put out your hands and it'll warm you, but you're not going to want to put your hands on the logs. That'll burn you. So that's the only caveat with PMF. Danielle, you'll let me know if you have another question.
Yeah.
Okay, I will talk about, let's pick anything here. So many choices, it's difficult to decide. We'll talk about frequency-specific microcurrent. So frequency-specific microcurrent is a very low-level microcurrent that is specific to the tissues that you're using. So again, all tissue vibrates. Every cell, tissue, organ, your whole body is vibrating. It has its own resonance, and each body part resonates slightly different from every other body part. So a liver vibrates different from a muscle. And what we found is if you duplicate that resonance of, let's say, a muscle, the resonance that a muscle is vibrating at, and you run a low-level microcurrent through that muscle, it will accelerate the muscle's repair. So we can target a muscle, we can target a joint, we can target the spinal cord, we can target an organ or a gland, and use frequency-specific microcurrent as one more way to accelerate recovery. A lot of CRPS patients come to me and they cannot even be touched because the CRPS is so advanced. So how do you treat a patient that you can't touch? Well, that's when we would use Roy G. Biv therapy, right? We use different specific colors of light, red, orange, yellow, green, all the colors of the rainbow, and we would shoot different types of light, either coherent light or scattered light, full spectrum light, through these lenses, these different colored lenses, into the body to help start decreasing the systemic and neurologic inflammation. And once we are able to do that, then we can actually touch the patient and do more hands-on type therapies. Another hands-off therapy is sound. Sound is very important. As I mentioned earlier, everything has its own resonance. Sound obviously has its resonance, different resonances, and so we have a couple different ways that we use sound therapy. One is we're using octaves of tuning forks, and we're shooting the sound into the body. It might be into a specific lobe of the brain, or it might be a CRPS body part that is in high pain, as a way to calm down the nervous system. Another way we use sound is with our machine, which is called Sound of Soul, based on Dr. Emoto's work, where we put a heart monitor onto the patient. It converts the patient's heartbeat into musical notes. Every characteristic of the heart is assigned a different note. We run that through a synthesizer and then out through speakers, and we find which musical instrument. Maybe it's steel drums, maybe it's a viola, maybe it's a cello, maybe it's conga drums, whatever. There's about 100 different choices, but we find which instrument will bring the patient into a parasympathetic state. We're actually changing the autonomic nervous system, moving the person into a parasympathetic state so that they can heal. Still, okay. And that's Sound of Soul. We have Vector, Vector is a machine developed by a doctor in Texas. It was designed specifically to treat CRPS. I personally have found that it's only effective for about 30% of my patients the way that I use it. I wish it was a higher number, although 30% isn't bad with the patients that we do see in my office. But it is a type of frequency-specific microcurrent. It's a little bit more involved. It's a bigger, more powerful unit, and the different nuances of a particular person with CRPS, the quality of their pain, their other symptoms, their age, their sex, what caused the onset. These all get plugged into a computer to then put out the exact pad placement and frequencies that we use. But that's the Vector. We do like that a lot. We have piezo wave, which is a type of ultrasound therapy that goes into the body and breaks up adhesions deep into the joints. Again, this would not be a machine for a CRPS patient that can't be touched. But for those that can, a lot of CRPS patients have adhesions in the joints or in the muscles and the other connective tissue, and piezo wave is very good for that. We have an ARP wave, neuromuscular reeducation. There are a number of clinics throughout the country that almost exclusively depend on the therapeutic benefits of ARP wave as their primary treatment for CRPS. For me, I've found that it can be quite inflammatory, certainly extremely painful for most CRPS patients to do ARP wave therapy, and so I don't recommend that in the beginning. Only a handful of very selected patients of mine get any ARP wave at all. And of course, with all of my therapies, I don't care what therapy it takes to get you better. I'm going to constantly be changing my program. I don't have a cookie cutter system. I'm going to find the right therapies that give you as an individual the best result. And that's why I have so many different modalities, because some people will respond well to one or two or certain combination, and someone else won't respond at all to that. So that is why having options is so important. Do we have another question?
Mm-hmm. What treatment is specific to reducing inflammation within the body?
So the question is, what treatment is specific to reducing inflammation in the body? Well, that's a loaded question. What is causing the inflammation, right? You can have inflammation because things are rubbing together, rub, and get inflammation, right? A lot of people, like with knee joint pain, can get inflammation in their knee from that. Someone can have systemic inflammation in their blood because they're eating food that they are sensitive or allergic to, and that's creating an inflammatory reaction in the blood. And then that is cascading throughout the entire body. So the first step is to find out the underlying cause of the inflammation and then use whatever treatment modality it is. It could be oxygen, it could be light therapy, it could be sound, it could be microcurrent, it could be diet, it could be supplements, it can be mental work. There's a lot of different therapies. You could say that every therapy that I listed helps decrease inflammation, but you have to find the right therapy specific to the individual.
What are your thoughts on frequency therapy like Rife?
Yeah, so I love frequency therapy. Rife machines, Rife was a research scientist back in the early 20s, I believe, 1920s, not the 2020s, not way back in 2021, but in like 1920s. And what he found is that everything resonates, everything has a frequency, and even viruses and bacteria do. And if you find the right frequency for bacteria, you can kill that bacteria. if you find the right frequency for an organ, you can upregulate the organ. So that's what all frequency therapy, I guess he's the father of frequency therapy. So everything like light therapy, microcurrent, pulse electromagnetic field therapy, these are all variations on that theme. Rife died without us getting his original machines, and there are a lot of people out there that go, oh, but I found the secret machine, I found his original research, and da-da-da, and you hear that every now and again, and I would take that with a large grain of salt. That being said, if you are using a Rife machine and getting results, that's fantastic. I'm all about resonance.
So this is from a patient. Piezo seemed to make EDS issues worse. Is that typical?
Yeah, so they have hypermobility, EDS, and they found that the piezo, which is this basically ultrasound going into the joint, made it worse. I can understand that. For some people it makes it worse, some people it makes it better. There's not one thing that helps everybody or hurts everybody. It is specific. But with that information that you gave me, I could draw a plausible scenario. With EDS, we have hypermobility. Well, what's one of the reasons why? They say it's ligamentous laxity, but the other component is joint inflammation. So when a joint swells, it pushes, any joint is where two bones come together, it pushes those bones slightly apart. Once you push those bones slightly apart, the plastic straps that are holding those bones together, the ligaments, then you start to get instability. So you've got inflammation in the joint. Now you're coming with ultrasound going into the joint, trying to break up adhesions. That's the primary thing that piezo wave does. So if you hit your knee one time and you have inflammation, piezo wave, and then some scar tissue, piezo wave is great in that case. But if you have some systemic cause of the inflammation and the joint swelling and the ligamentous stretching and instability, then I can see that piezo might just, scar tissue can be a bad thing, but it can also be a good thing, because the reason your body put it there is to try to stabilize things. So if you come along indiscriminately with the piezo wave and remove that stability, then you can make that joint, which is already too loose, become even more loose and be inflammatory. So this goes back to, you have to find the underlying initial cause, the root cause of the problem, and then come up with a therapy. You can't just do a therapy to do a therapy, or do a therapy because it's your system. You have to do therapies that are exact, specific to the individual. So, if we have one more question, I think we've got time. Great.
Yeah.
Well, I hope that was informative. If you have more questions about the therapies that we do or our reasoning behind that, you can reach out in the comment section. Please tell your friends we are on here every week, Tuesdays at 2, from 2 to 2:30. Make sure that you are logging in every week and sharing what we have to say. And I hope you all have a speedy healing journey. Take care.